Appendicitis, Anatomy 403. A patient comes in complaining about pain in their right abdomen. They explain to you that the pain started out in the navel region and has since spread to the right side of their abdominal section. Since then, they have a loss of appetite, bloating, and some nausea and vomiting. The patient told you that their pain gets worse when they walk. Given the information that your patient gave you, you begin to suspect appendicitis. You begin telling your patient about appendicitis. Appendicitis is caused when the opening of the appendix is blocked. Your patient asks what the appendix is. You tell the patient that the appendix is a long tube-shaped sac that arises from the inferior tip of the cecum, which is known to be the beginning part of the large intestine. The base of appendix is attached to the cecum. However, the remainder of the appendix is free-floating. This is why there is a variation in where the appendix sits in the left side of the abdominal cavity. The actual function of the appendix is not yet clearly understood. However, there is some evidence suggesting that it plays a role in the immune system. The initial event that leads to appendicitis is an obstruction in the lumen. This obstruction may be due to a variety of causes such as feces, lymphatic tissue, a foreign object, or even a tumor. Once the obstruction has occurred, epithelial mucosal secretions accumulate, causing hypertension and distension. As the tension in the appendix increases, luminal pressure begins to exceed capillary perfusion pressure. Lymphatic drainage is impaired and ischemia develops, resulting in the breakdown of the protective epithelial mucosal barrier. The bacteria that are typically found in this region will begin to invade the tissue of the appendiceal wall, causing the inflammation of the appendix. As a result, the appendix becomes swollen and filled with pus. If left untreated, it will eventually rupture, allowing the infection to spread. You tell your patient that treatment is a must. The chief complaint from patients with appendicitis is typically persistent pain in the epigastric or periumbilical region of the abdomen. As appendicitis progresses, the pain will shift toward the right lower quadrant. Patients may also experience loss of appetite, bloating, worsening pain when walking, nausea, and vomiting. The next step is the treatment of appendicitis. The most effective and common treatment of appendicitis is surgical removal of the appendix, or an appendectomy. This is a common and basic surgical procedure that can be done either by an incision or via laparoscopy. However, today laparoscopic surgery is typically preferred. Now we will look at the steps of a typical appendectomy. Before surgery, the patient is treated with medications or IV antibiotics to reduce nausea, vomiting, and infection. Then, a 2 to 3 inch long incision is made in the lower right side of the abdomen. Next step is to separate the appendix from the mesentery. This step is followed by bipolar forceps delivering an electric current to seal the blood vessels and to prevent bleeding. Next, we position a pre-tied suture to tie off the appendix and snip the free end of the appendix using scissors. Finally, incisions are cleaned and closed. The time it takes to fully recover takes about 4 to 6 weeks. It is crucial that during this time, the patient limit their degree of physical activity. Now, remember that especially before a large procedure like surgery, the patient must give informed consent. In order for the patient to be informed, it is crucial that you explain the complications that could occur with or without the surgery, since there are risks to both. Among several potential complications resulting from an untreated appendicitis, the most common one is perforation of the appendix, which leads to spreading of inflammation throughout the peritoneum. This causes peritonitis, or the infection of entire lining of abdomen and pelvis, which can be fatal. A less common complication resulting from an untreated appendicitis is blockage or obstruction of the intestine caused by the inability of intestinal muscle to contract due to the inflammation surrounding the appendix. This may often lead to vomiting once the space above the blockage becomes filled with liquid or gas. Sepsis, on the other hand, is a quite rare but fatal complication. It occurs when the infectious bacteria from a ruptured appendix enter the bloodstream and travel to other parts of the body. This presentation has been created from the resources from the following websites.